Good afternoon. My name's Robert Martiniano. I'm with the Center for Health Workforce Studies. And today we're doing this webinar to help you fill out a survey that we've sent out on behalf of the AHI PPS to help collect data on your current workforce. So I'm doing this along with Kelly Owens, who is the workforce manager at AHI PPS. Kelly, say hi.
Hi, everyone. Thanks for joining today.
Thank you. So we're going to be a little informal here. So we've unmuted you from our end, and what I would suggest is you mute yourself from your end. If you have a question, you can unmute yourself, shout it out. You can also raise your hand, or you can use the chat box. We'll try to manage all three and make sure that we get to any questions. And again, I want to make this informal, so as you need clarification and as you need information, please ask your question. And as you see, there's my contact information. There's also, on the information that we have sent out, you also have contact information for Lauren, who's here, and Evan, who's here. Okay. So just who we are for a second. We're at the School of Public Health. We do a lot of surveying, data analysis, et cetera, around health workforce. And we've done a number of things with the Adirondacks. I've worked on the community health assessments up there. I've done a number of things with the AHI PPS, as long as being on one of their work groups or a couple of their work groups. And so we're very familiar with not only the trials and tribulations you are going through up there regarding your health care, but just how you're organized. So, Kelly, why don't you talk briefly about how this fits into the broader PPS deliverable?
Sure. So the compensation and benefits analysis is a requirement by DOH, and the intent of this particular workforce milestone or requirement is to really measure the impact of DSRIP implementation across the duration of DSRIP. So what they've asked is that the compensation and benefits analysis, which, if you've seen the document, you'll also know includes information related to your current staffing levels as well and vacancy rates, to really measure that impact over time. And we are looking at that for DSRIP Year 1, which was completed March of last year, DSRIP Year 3, and then the final compensation and benefits analysis will be complete for 2020. We do really appreciate everyone's assistance on this. On the first compensation and benefits analysis, we had 80% participation across the PPS, which is phenomenal. And in order to accurately measure progress through Year 3 and Year 5, ideally we need to have every organization that participated in the first assessment completed in those years, but then also our new partners who may have joined since DSRIP Year 1, we would like to have the most valid representation of the PPS as possible.
Thank you. Anything? Any questions so far? Okay. So on Monday you received a survey from Lauren and a link to the survey actually, and a link to our website. So we are actually here to help you do all the things you need to do to complete the survey. So we have our website. We're available for phone calls to assist you. And on our website we have a number of things. We have a list of the job descriptions which you will need as you're filling this out. We have frequently asked questions. We have instructions. And within a week or so, we're going to have this webinar, so you can actually go back and refer to it if you have any specific questions. And again, we are available for calls as needed. So as Kelly pointed out briefly, this is part of a deliverable that is required by New York State Department of Health. And as she noted, we've helped with data collection 1, which is DY1. We're also, we're in DY3, and eventually we'll be doing DY5. And there's a couple of things that we ask for in these surveys or this assessment. One is just body counts. and we'll talk about that briefly. And the other thing are compensation and benefits. What are you paying your people? And we're going to talk about this a little, but the salary and benefits information are covered by federal antitrust laws, so everything that we do in collecting that data, we have to follow certain rules, and we'll talk about that in a little bit. So we sent out, as I said, on Monday, Lauren sent out to you individual emails that included a link to the survey that you'll be filling out, a link to our web page that you will be, that has all our information on, our contact information, and also your previous survey from 2015, if you completed one at that time. And that was filled out to help you understand what you told us and also how you indicated what your facility type was at the time. And we'll talk about facility type in a little bit. Please, just as an aside, do not return the 2015 survey. We have that. We don't need it, and it's just for your edification to understand kind of where you've been and how you reported things, and not for any formal way to resubmit. Okay. The first thing you need to do when you open the link is save it to your hard drive, and that's somewhat easier said than done as we've experienced this now. If you open it and start filling it in and then send it to us, it actually doesn't save the data. What you need to do is save it to your hard drive or to a memory stick or something, your desktop, for instance, then open it, fill it out, save it, and then send it back to us. I know there are some people, and we've run into this, where they don't have administrative rights to save anything to their desktop. So I would, in that case, either talk to your IT people, and maybe that's where you can use a memory stick that's not being protected, and just save it. As you think about saving it, think about how you want to save it. So if you just say, AHI PPS survey, if I get 10 of those, we're not going to know who it's from. And if we start saving them, obviously we could overwrite each other. So try to give enough information about who you are as you give it a name so that we can track it. And on this slide, you see an example. Now, one of the things we're going to talk about in a little bit is that you have to report for different facility types. So if you're ABC Healthcare and you've got an inpatient and an outpatient, you may want to distinguish between the two. So think about that. So you may save it once, and then you're going to have several versions of that. Okay. So a couple of things. One is we're only surveying those providers or those portion of your workforce that's in the 9 AHI PPS county. Well, again, we're surveying by facility type, and there's 9 or 12. I'm spacing out right now.
There's 9.
Thank you.
9 counties.
Well, 9 counties, but how many facility types are there? Like 12 or 13?
Oh, I'm sorry, facility types. Yeah, I think we had up to 12.
Right. So we're asking you to do it by facility type, and you need to be very careful as you're thinking about who you are to identify your staff by those facility types. So, for example, if you're in these 9 counties as well as in a Saratoga or another county outside of this PPS, Saratoga, Montgomery, or Fulton, and you have staff that's covering both, you want to prorate those staff. So let's say they're 6/10 of an FTE are spent in the 9 counties, and 4/10, you only want to count those 6/10. Similarly, with administrative staff that may be covering multiple counties inside and outside the PPS, you're going to want to prorate those by FTE. And we'll talk in a little bit about what is an FTE and how to calculate it. Any questions right now? I'll stop and give you a chance to ask anything. And I know some of this is rather complicated at times, and we'll try to help as much as we can. Okay. So again, we're asking it by facility type and not by counties. So if you've got 3 sites within the 9-county AHI PPS, we only want, for that facility type, we only want one survey for that facility type. So if you're in Warren, Washington, and Essex County, and you're doing home health care, one survey. If you're in Warren, Washington, Essex County, and you do home care as well as nursing homes, we're going to want 2 surveys, one for the nursing home and one for the home health. And again, you know, going back to things like FTEs and administration, you're going to want to prorate that. So if you've got IT staff, administration, or things like that that cover both home health care and nursing home in the example I gave, you're going to want to prorate those between the facility types. So you may say, well, you know what, we're pretty even, so 0.5 and 0.5, or maybe, you know, it's 2/3 nursing homes, 1/3 home care, you know, 0.67, 0.33. And again, we'll talk about FTEs in a little bit. Okay. So let's talk about facility types right now, and these are mandated to some extent by DOH. So there are, I believe, 12, if I just did a quick count, that we're going to ask you to break out. So as you can see, we're asking for inpatient services broken out by not only acute care and ER, but also by mental health and substance abuse. So, and same with outpatient. So are you in Article 28, which means are you a hospital doing inpatient and outpatient care? We're going to want 2 surveys. If you're an Article 31, which is OMH, or an Article 32, which is OASIS, again, we're going to want inpatient and outpatient. So the question is, what if I don't fit into any of these facility types? So for example, if I'm a county health department and I don't cover under any, then I'd be an other. If I'm a residential care facility, like a group home under OMH or OASIS, then I'd be an other. So again, if, I know this is a little weird and complicated, if you have questions, please call us, please call Kelly, and we'll try to work our way through what you think we should be in. And as we've done in the past, Kelly and I and Lauren and Kelly talk on a regular basis, so as questions arise that we can't answer, we will reach out to AHI PPS staff and try to get clarification and get back to you as soon as possible. And again, thinking about this, so if you're I know a lot of the counties still have home care agencies. So if you're one of those, you're going to break your staff out between your home care agency staff and your other staff that may be providing other services. Like if you have a Department of Health clinic for on maternal health or on STDs, you're going to break that out versus and report that under other rather than reporting it under home care. Okay, so again, I'm going to give a brief pause in my speaking to let you guys ask any questions you may have before we continue. Okay. So let's actually go into the survey. So the survey is a fillable PDF, which means once you save it, you can actually attach it to an email. So let's say you can answer some questions and somebody else on your staff can answer another question or other questions. You can actually save it to your hard drive, as we've talked about, fill in what you can, and then email it to somebody else, and they can fill it in, save it, and email it back to you. Again, just remember, you always have to save it to your hard drives. So I don't know if I said this, but if you open it up through the link and fill it out and then try to email it to us, it doesn't save any of the information. So just remember, save it, fill it out, save it, and then email it back to us. Okay, so this is the first screen. We're just asking for general information about your organization. As you can see, about 2/3 of the way down, we asked you for your facility type, the ones that we listed before. You just click on that. We're also asking if you're responding for a single site or multiple sites, and if so, how many. And the reason why we're asking that is who you represent. There's actually going to be another part of the survey we're going to ask you to just list your sites. You don't have to break out your FTEs and your other information we're collecting for those sites, but we do want to know whether, who those sites are. The other thing we're going to ask you is about fringe benefits. And people kind of do fringe benefits different ways depending on if they are, I know hospitals may have some people that are unionized that have different fringe benefits than other staff. So if you're an organization and you have the same fringe benefit rate for everybody, and we can talk about what that means when we get to it, just hit yes and indicate what that fringe benefit rate is. If it's different for different staff within your organization, and then please indicate that. So no, it's specific title, and when we get to the titles, we'll actually go through that. There's actually a column that for each individual person. Okay. So again, this is just the kind of the who you are. So let's talk about data collection a little. We're collecting data as of September 30th, and that is for everyone. So as of that moment, how many staff do you have on hand? We are asking for other things that may or may not relate to September 13th, but you'll see them when we get to them. It's going to help us plan, help the AHI PPS plan. It's going to look at how things have changed since this project has started, and we're going to compare it to potential need. So for those of you who were involved since 2015, AHI PPS in consultation with an outside group actually developed what they thought the need might be in your 9-county area based on your population, based on your healthcare needs. So in some ways, we've been tracking data against those needs to try to understand where we are against those and what we think we need going forward in our community or in your community. So there was a couple of reasons why we did September 30th. One was generally hiring of new students is done by then. So you're not seeing kind of the ups and downs of unemployment. Also, generally by then, the summer help, if you hire any, is done. But also, as I said earlier, we have to follow antitrust laws in capturing salary and benefit information. And one of the requirements is, one of the requirements is it's got to be done by an outside agency. So we collect the data, we only report it in aggregate. AHI PPS and does not see the individual data nor anybody else. So anything that we share with them, that they share with DOH as part of their requirements, are always in the aggregate. It's only, we can only share it if there's 5 or more entities reporting on an occupation. So even though I may have, 80 or 90 organizations responding to the survey, if only 4 say, I'm going to use RNs, I know that's not possible, but only 4 report on RNs, we won't report salary and benefits for that information, for that title, I mean. We do, however, report the counts. That's not protected by the antitrust law, so the number of bodies, the number of FTEs, and we'll go over all these in a second, the number of potential retirements, we can report regardless of the number of people who report, but the salary and benefits we will not report. And as you can see, as we ask for compensation, it's basically the salary they're getting. Now, benefits are those things that you pay for, like retirement benefits, health insurance, long-term care insurance if that's possible or part of your package, FICA that goes to the federal government, workman's comp that goes to state. So those things that are part of your benefit structure, and maybe healthcare could include straight healthcare, could include dental, could include eye. So it's all those things that are, as you add up, become a proportion of your benefits. Most organizations, when they budget at a certain percentage. So like it's 28 or 30% of what I estimate my personnel costs to be, 30% goes to benefit. So again, as we talked about in the previous slide, or a couple of slides, if you say everybody gets 28% or 38% straight, I pulled it up. You just click same for all employments, hit yes, put in 30%, and you're good to go. Oh, we've got a question, sorry. No, it does not. All right, so the question is, I'm sorry, I should read the question. The question is, does it include shift differential? Kelly, correct me if I'm wrong, but when Department of Health put out the rules for this, shift differential was not considered part of salary and benefits.
I believe that's correct, but what I can do is go back into some of the information from DOH and confirm that.
Yeah, DOH, when we all started this, DOH had a meeting and they had slides from December of 14 maybe, it's been that long, that included shift differential wasn't part of it. That's a great question because, I mean, from my perspective, it should be because that's actually part of the salary. But again, I think DOH said no. So, and Kelly and I will check on it and we'll get back to you on that.
Do we have a way to get back, or can we post maybe all the questions that are asked on this particular webinar? Can we post answers to all the questions as well?
Sure.
Okay.
So Lauren is going to start writing down questions. Okay. Okay, so again, so compensation and benefits, and actually what we, the other thing we'll do, and we did this last time, we'll do this again, is we posted the December slides for somebody. Did we do that for you, Kelly?
I don't think so.
Okay, but we can do that. So we'll find those slides and actually post
okay.
That will give some background to that, well, how DOH describes some of this.
Okay.
Okay. So any questions about comp and benefits or kind of the antitrust rules? Okay. So we kind of talked about data in general. So as you get to your the part 2 of the form, you're going to see a number of healthcare occupations or professions listed. And if you can see this on your screen, there's a box all the way to the left that is next to the 01, 02, 03, et cetera. And when you click that box, it highlights the whole roll across. So if you say, well, I have primary care physicians, but I don't have emergency care, I have pediatricians, but I don't have hospitalists, you actually check the box and ignore the other one. So you'll fill out that row, and anything that's not checked, you'll ignore. And we're going to go into the specifics of each of what these columns entail. Okay. So before we get into that, I want to talk about the job descriptions a little. There's about 100 or so in your file, yeah. And for each of these, there's a job description in a PDF that we've provided you. So we generally know that, yes, PAs actually are, so the question was, are PAs included? Yes. And we just gave an example, but there are about 100 occupations. It starts with physicians, goes to PAs, NPs, and then breaks in nursing, paraprofessionals, allied health, I think pharmacy. I don't have them all off the top of my head. But so as you look at the job occupations, if you say, I don't think I have that, but I have something that may be similar, we included a PDF on our webpage that describes each of the occupations. So you can actually say, does it match, does it not match? If you decide ultimately that it matches, put it in with that. So I know we had a question once, you have psychiatric aid, but we call them behavioral aids. Well, when they looked at them, they pretty much were the same thing. So again, as you think about it, how close is it to the definition? If it's not close, then go with the other field. Is that another question? Okay. All right, so let's talk about the individual, mouse isn't working. Let's talk about one more topic before we get into the requested information, and that's physicians. So if you are a hospital or nursing home or another healthcare provider that physicians come in and out, we don't want to know about what we call attending physicians. Those physicians that have private practices that may be coming in to check on their patients. We don't care about those physicians. What we do care about, though, are what we call contracted physicians. So they're not necessarily hired by the staff, by the organization, but you may be contracting with an entity that basically sends them to you. Those we do want to know about. So just if you have questions about those physicians, who you have, who you don't have, please reach out to us. We have another question. Oh, so we got a question is, what should we do if we put something in the wrong job description on the last survey and want to change it? I would fill it out correctly on this survey, and I would email us, and we can fix it on the old survey and on our old data sets, so that information that we provide, Kelly, that the comparison, we will fix that. That's a great question, and thank you. We've actually tried to do that on a couple where we've noticed that, but if you have something you've noticed, please let us know and we'll make the fix accordingly. Okay. So again, for physicians, if they're on staff or you contract with an agency to provide them, please count them. If they're attending, don't count them. All right, if you have so another question, if you have someone who has multiple job responsibilities, do we count them only once on the survey? That's a good question. We've run into that a few times. So it depends on, I guess that my answer is it depends on how you fund them. So if they're on one job title and they're doing multiple things, I would keep them to the title that's closest. But if they're funding through multiple titles, so let's say they're half-time as a OT and half-time doing as an administrator or something, and they're literally on two different funding lines, then I would count them 0.5 and 0.5, again, as an FTE.
And put one body.
But they'd be counting one body in each place. Lauren just said one body. So unfortunately, they're counted as kind of one body in each place, but 0.5 FTEs in each place. And we'll talk about the difference between bodies and FTEs starting on this next slide. Before I go any further, any other questions about physicians and how to count them? And again, as I said, Lauren, Evan, and I, and other staff at the center are available for phone calls and emails. Okay. So, as I said, we talked about number of bodies. So, if I was to hire Kelly and her staff, and regardless of whether they're full-time or part-time, 3 people. So, number of bodies, number of staff in each title. So, I've got three RNs, 3 physicians, 3, PAs, 2 nurse practitioners, whatever. So, we're talking full bodies, regardless of how many hours they work. Now, that's where we get into FTEs. And an FTE is based on the number of hours they would normally work in a week. So, for example, if your normal work hours for that title is 40 hours, and they're working 20 hours, it'd be 0.2 FTEs. I'm sorry, 0.5 FTEs. So 20 divided by 40 would get 0.5. So if their normal hours are 37.5 and they're at 22.5 or 3 days a week, they'd be at a 0.6. And I figured I took 22.5 just because I could do the math in my head easily. So again, you got to think about what their normal hours would be working full time and then adjust accordingly their FTEs. So going back to the example of Kelly and her staff, if I've got 3 bodies, they each are supposed to work 40 hours a week if they were working full-time. Kelly's working full-time, and I've got 2 other staff that are each working 20 hours. I've got 3 staff, 40 plus 20 plus 20 would equal 80 hours, and divide that by 40, I've got 2 FTEs. So again, there's going to be a little math in doing this, but you have to, again, think about how many bodies, how many FTEs, and usually it's pretty easy just to do a computer run if you've got an automated HR system. If not, it's a little more work, but you can just kick out the number of bodies and the number of hours they work and kind of work your way back. So let me stop because, again, I know FTEs are can be difficult. Does anybody have any questions? Okay. All right. And as I said multiple times now, we are available for questions after you digest this all. So, the other thing is everything we ask for in terms of vacancies and intend to fill and other things are in FTEs. So vacancies and intended to fill. So if you have a position that you do not have full-time staff hired for, and I'll talk about that in a minute, and you are actively recruiting for, consider that vacant. So what do I mean by actively recruiting for? So we know that there are a number of organizations that may have a position but decide not to fill it for financial reasons and you're not actively recruiting. You really wouldn't consider that vacant. But again, if you've got a position that's vacant or filled by temporary staff, consider that a vacant position. So what do I mean by temporary staff or agency staff? So you've got a nursing position, you're actively recruiting, but you've been using some staffing service to bring in the nurse. That is considered a vacant position. You also do not want to count that agency staff or that temporary employee as an employee too. So, okay. And then, oops, wrong way, sorry. So then we're also asking for the number of potential retirements in 2018 and the number of anticipated positions added in 2018. And again, these are going to be based on FTEs. So you know that 3 people are retiring and they end up being two FTEs, just tell us 2 FTEs. You think you're going to be adding 5 staff and they're all full-time, 5 FTEs. If they're 5 staff, but they're going to end up being, so it'd be 200 hours at 40, and you're going to decide that it's really only 160 hours that they're going to be hired for, you're adding 4 FTEs if you're using a 40-hour work week. Again, you're going to have to calculate FTEs based on what you consider our normal full-time hours for that position, and that may vary in an agency. So some hospitals, nursing may be considered 36 hours, so 3 12-hour shifts may be considered full-time. So whereas management may be considered 40 hours, or your nurse aides or something may be 8 to 5 jobs or 40 hours. So again, you're going to be looking at it differently for different occupations within your agency. Okay, so average hourly wage. So again, this is a requirement of DOH. And actually, the question that was asked previously about shift differential actually is described in here. So actually, so one of the things, again, so shift differential is not included, also on-call pay. So I know a lot of times nurses will be said, stay home because we don't think we have enough beds to work tonight, but you'll get whatever you get. So for the hours that you're on call, that's not included. So it's really that salary you're getting after you've gotten a cost of living wage or any kind of other increase in wages that's based on, that's not your base salary. So what you need to do to figure out your hourly salary is take that, whatever that is annually, if you don't have it hourly already, divide by 52, divide by the number of what's considered full-time hours, and you get your average hourly salary. So for example, if I'm going to be really simple, but if you were working 20,800 hours, I believe, I'm sorry, you're making $20,800, you divide that by 52, you divide that by 40, you end up with $10 an hour. If 40 hours was what you considered your a full-time worker on that. So again, so take your annual salary, divide by 52, because you pay everybody over a course of a year, divide that by the number of hours are considered full-time, and you get a salary. Okay. Next slide. So fringe benefit we've talked about already. Again, it may be by different title, and if everybody's the same, you fill in the thing on the first page as we talked about, and you don't have to fill it in on this part of the survey. If it is different, then please fill it in. If you have questions, and generally it's going to be over 10 to 12%. So even the small agencies that may not do retirement and other things, you still have to pay FICA to the federal government. You still have to pay workman's comp. So that there's always a base there, and you should talk. If you've got an accountant, I would talk to him or her about that. And you can call us. I generally don't know your benefit package, but again, if you start adding in health care, FICA, Medicaid, Medicare, although that comes out of our salaries directly, other things that may come out that your employee isn't charged for, that's part of the benefit rate that you're going to calculate. And so once you find out how much that is, then just divide by what the salary is. So again, going back to the example I just had, if you add up all your fringe benefit rate costs and they come to $2,080 and we're at $20,800, your fringe rate is 10%. I know that's very basic, but that's kind of how you do that. I think it's going to be more complicated as you start adding in things, and you can talk to us if you need assistance, talk to whoever is doing your books, and if you have an HR department, they probably have a really good handle on this. The last thing we're asking for on this is the CBA. Do you have a collective bargaining agreement for anybody in that occupation? We didn't ask it facility-wide because generally not everybody at a facility is under a collective bargaining agreement or unionized. So for that occupation, are they unionized? So you may have RNs are unionized, physicians are not physicians, they're generally not unionized. OTs and PTs may be unionized, but nobody else. Again, as you think about who's unionized and who's not unionized, please indicate that. This is also a requirement of DOH. So again, fringe benefit and collective bargaining agreement are requirements of DOH. So we're almost at about 2:40. I've got a few more slides, and then we can ask any general questions and keep going with questions that you may have. So there is something we're asking about nursing that's a little different than everybody else. We are asking that for your nursing staff, your RN management, and your RN floor staff to break out by degree type if known. So if you know that, for example, in this one, if you know your nurse managers, who has associates, who has bachelors, or who has masters, please fill that out. If you do not know, then only fill out 18 and leave 18.1, 18.2, and 18.3 blank. Same with RNs who are on staff. If you know everybody, what everybody has for a degree, fill out 19.1, 19.2, and 19.3. If you know some but don't know others, then just fill out 19. So either you're filling out 18 and 19, or you're filling out 18.1, 18.2, 18.3, 19.1, 19.2, and 19.3. Do not fill out both, 19 and 19.1, 2, 3, because we won't know if it's additive or if you're just, it's a subset. So just one or the other, please. Finally, as I said way back at the beginning, we're going to be asking for, if you have multiple sites, who those sites are, and you just have to fill it here. And how this works, if you said, I have 8 different sites, the first site will be listed on the first page, and then you're actually going to see 7 of these kind of pop up. And so you just have to fill in 7. Okay. The assessment is due no later than November 3rd. We've already gotten a few. So you can send it to surveys@chwsny.org. If you have questions now or later, let us know. We're always available for phone calls and emails. You can also email, you could actually also email to this if questions, and also when we sent it out, we gave Lauren's email, which is, and I'll give it again, lboyd@albany.edu, and I'm rmartiniano@albany.edu, and I believe I was on the first slide, wasn't I? So again, either Lauren or I will respond to you. If it goes to Lauren and she can't answer it, she asks me. If I can't answer it, I go to Kelly. And then if Kelly can't answer it, we'll call DOH and see if we can get something. But usually by then, we've got you an answer.
Oh, I got ya. Yeah.
Okay, so we've got about, 18 minutes left. Does anybody have any questions about anything I've talked about? Again, you can ask later too or email us. Kelly, do you have anything to add also?
No, just that we really appreciate everyone's time in completing the assessment. Our goal is that the Center for Health Workforce Studies will have time to calculate all the data that's provided. The compensation and benefits work group will begin meeting in January to make sure the data is 90 days old, adhering to the antitrust rules, only looking at the aggregate information and pulling together a narrative related to that. And then ideally, we'd also be able to compare that to information that we received for DY1 and start really getting an idea of where we are headed as a PPS. If we're starting to see, hopefully we're seeing trends increasing as far as the number of primary care providers, the number of behavioral health providers. We know post-acute care is also a need with our home health aides and CNAs and PCAs. We'd like to see those trends, and if they're not changing, we'd also want to identify how do we modify what we've been doing to recruit and retain our workforce to improve where we are right now. So thank you very much. I'm really impressed with the number of people who are on the webinar, but always feel free, as Robert said, to either reach out to him, Lauren, Evan, or myself. We're more than happy to answer any questions.
Yeah, and as I said before, and one of the questions that came up, as you fill this out this time and you realize that you may have misclassified an occupation before, just please call us and we will fix that so that when we do the comparison from the first year, we'll have an appropriate comparison. So again, any questions? I don't want to cut anybody off, but we've got no questions in the chat box, no hands up. No verbal questions, so I want to thank everybody for joining us. I know this is difficult to do. It takes staff time away from actually dealing with our patients and clients, but it's important to help the AHI PPS understand where they're going with their programs that they've done. And again, we are available for any questions you may have, and I thank you for your attention and your time today. And again, please call me if you need anything.
All right. Have a good afternoon, everyone.
Thanks. Good afternoon.
Bye-bye.